Hello, it's Nusrat Hashem. I'm one of the geriatric medicine registrar in Leicester Royal Infirmary. Today I'm presenting a poster regarding my QIP, whose title is Enhancing Junior Doctors' Competence in Advanced Care Plan Discussion, a focused training initiative. So, giving some background, in UHL we use EHCP, Emergency Healthcare Plan, as a form of advanced care planning, where we discuss with the patient and the family regarding anticipated medical problems and outline a specific plan and management in case of medical emergency, which needs to be taken place in the community preferably. So the aim of the QIP is to find out the barriers the junior doctors face in leading and documenting advanced EHCP discussion, and also to run a series of teaching program among various levels of junior doctors to make them confident in leading the discussion and also competent in documentation. So given that the aim, I'm telling you about the methodology, how I collect data. So I have seen from January to March in 2024 how many EHCP has been documented among the UHL, which showed is 39. Then I have run through some teaching program, mostly geriatric doctors, ward doctors, and ward level doctors in geriatric teaching seminar, and also some ward based teaching program. So after that we have collected another data from June, July and August, which showed around 36 EHCP has been documented among the UHL. So that is pretty same. So we are running now the second cycle of the QIP, where we are expanding our teaching program to various levels of doctors, like ward doctors, geriatric doctors, and also trainee doctors like IMT, foundation level doctors, and also GPST trainee. So, and then we will gather the data. So giving a brief about the teaching program, so it's usually 2-hour teaching program where we discuss briefly about what is advanced care plan, what is emergency health care plan, and we also talk briefly about the SPICT criteria, which is supportive and palliative care indicator tool. We also discuss about clinical frailty score, and also we talk about RED map framework, which is a useful tool to initiate the discussion. We discuss what the anticipated medical problems we discuss in the EHCP. For example, a patient who is very frail, who is bedbound, having the CFS about 9, and there's the patient, and if he is having stroke, is there any benefits in hospital admission, or is there any way we can treat in the community? So in case of infections, in case of shortness of breath, like this, every scenario we discuss with the patient and the family, and to make a collaborative plan how it can be managed at the community. And like this we lead the discussion, and eventually if they agree we make a plan, and that's documented in the server, and the documentation is provided with the patient, care home and GP to follow. So that's the teaching program. And also we have find out that in the second cycle, I took the data. I found out that in June, July, August in UHL about 250 to 300 people patient has been admitted who has clinical frailty score 7, 8, 9, like severe frailty. But on comparison, only 17 patient in June, 16 patient in July, and only 3 patient in August have the EHCP documentation. So there are a number of patients who can benefit from the advanced care plan. So that's our target, to increase the numbers in the frail patients so that they can have a good outcome in the community. and also avoiding the unnecessary hospital admission. We also get that feedback from the teaching program, which showed the teaching program has been rated 8 or more, and which showed 63% of the people attending the teaching program found confidence, and also 78% feel confident in documentation of the EHCP. Only 21% asked for further demonstration. We are working on that. There are some limitation. Initially on the first cycle we only teaching only 1 grade doctors, mostly trust grades. In second cycle we are focusing to teach among various groups like trainee doctors and ward doctors and trust grade doctors as well. And also there are a group which need further demonstration, so we are thinking maybe an interactive poster giving the details how to carry on with the discussion, what the point needs to be discussed, sharing the SPICT criteria, red back frame on the poster might be helpful, and that can be supplied to every ward so that doctors get easy access. Another options is maybe a drop-in sessions with a small group of doctors having a discussion in a simulated manner under trained physician might be helpful. We are working on that. Also, we haven't included the data why the junior doctors facing difficulties. What's the reason for not having the discussion or not even initiating the discussion of advanced care plan? So we are hoping to add this information in the next cycle. Thank you for watching.